So, have you heard about the new asthma guidelines that just came out?
Oh, the ones from NICE and those other organizations?
Yeah, exactly. They're a collaboration between NICE, BTS, and Sign. It's, pretty groundbreaking stuff.
Really? What's so different about them?
Well, they're focusing a lot more on accurate diagnosis and objective testing.
Hmm.
They want to improve how we manage asthma in both adults and kids.
That's great. So they're emphasizing tests over just symptoms?
Yeah, precisely. They recommend using objective tests like spirometry to confirm asthma rather than just going off of symptoms alone.
Right.
It's about getting a clear picture.
That makes sense. I've heard misdiagnosis can be a big issue.
Absolutely. Misdiagnosis can lead to overtreatment or undertreatment,
Exactly.
and that's a real problem.
So do they cover treatment options as well?
Yes, they do. They're updating recommendations on pharmacological treatments, especially for different age groups.
Oh, interesting.
It's more personalized now.
Personalized how?
Well, they have specific plans for adolescents, children under 5, and those over 12.
Okay,
So treatment is tailored to the patient's age and needs.
that's really helpful. What about monitoring asthma control?
They emphasize regular monitoring to keep asthma in check.
Yeah.
It's about adjusting treatment as needed to prevent attacks.
Speaking of attacks, do they address severe asthma?
Actually, no. This guideline specifically doesn't cover managing severe or acute asthma attacks. That's handled elsewhere.
Got it. So this is more about chronic management.
Exactly. It's about long-term control and reducing the risk of future attacks.
Right.
Keeping people stable.
Do they talk about self-management at all?
Yes, they do. They encourage patient education and adherence to treatment plans. Empowering patients is key.
That's so important. When patients understand their condition, outcomes improve.
Definitely. And they're also addressing environmental factors like outdoor air quality.
Oh, yeah.
Air pollution can be a big trigger.
Absolutely. So are these guidelines already in effect?
They were published on November 27th, 2024.
Right.
So they're the most up-to-date recommendations we have.
That's great. It sounds like a comprehensive update.
It really is. And the fact that it's a collaboration makes it even stronger. It brings together
Yeah.
the best expertise.
I'm curious, do they mention anything about asthma in pregnancy?
Yes, they have specific recommendations for asthma management during pregnancy and breastfeeding.
Oh, good.
It's crucial to handle that carefully.
For sure. What about occupational asthma?
They do cover diagnosing occupational asthma. It's
Interesting.
important to identify if someone's work environment is a trigger.
Absolutely. Early detection can make a big difference.
And they also talk about the organization and delivery of care, emphasizing risk-stratified approaches.
Right.
It's about efficient use of resources.
Makes sense. So overall, sounds like these guidelines are a big step forward.
Yeah, they really are. It's exciting to see such a thorough approach to asthma management. Hopefully
Yeah.
it'll lead to better outcomes for patients.
Agreed. I'm looking forward to seeing how these changes impact care in the real world.
Me too. It's all about improving quality of life for people with asthma.